Hello to everyone, my name is Andrea Agostini and I am the product manager of Hepilor. In this section, we are going to talk about what is Hepilor, how it works, and I'm going to show you the case study and different formulations we have. First of all, what is Hepilor? Hepilor is a medical device with regenerative and protective activities of the digestive system mucosa. Hepilor molecule was invented in Japan around 1989. In 2002, it was launched in America and in 2014, thanks to HV, it was launched in Italy and in Europe too. But the important question is, what is the molecule which gives to Hepilor the success? It's the zinc L-carnosine reported as 3D model in the current slide. This molecule has no systemic absorption, does not affect physiological pH, and it is characterized by highly mucoadhesiveness, make it strongly sticky onto damaged mucosa for several hours. Here we summarized the main actions and functions of Hepilor. Hepilor is able to slow down inflammatory process by regulating NF-κB factors, to promote healing process of mucosa by acting on the insulin-like growth factors, and at the end to enhance mucosal defense by stimulating heat shock proteins. The combination of all these actions promote mucosa healing process. Here we are going to talk about the main clinical studies carried out on the zinc L-carnosine. The first study, published on the Journals of Pharmaceuticals, demonstrated the anti-inflammatory action of Hepilor. By looking at the graph, you can see that the higher is the Hepilor concentration, the lower is the interleucinate associated to the inflammatory process. In this study carried out on the in vivo rat animal models, it is possible to observe how Hepilor administration significantly reduces the ulceration area. Third studies highlight the effect of Hepilor on the heat shock protein expression that protect the cells from external damages. It is clear how Hepilor increased protein expression by increasing cellular defenses and, as a result, by reinforcing the mucosa. From a pharmacodynamic point of view, Hepilor is able to prevent genomic modification and the production of neoplastic cells through its antioxidant and anti-inflammatory actions. This study was carried out in collaboration with the Department of Radiotherapy of the University of Perugia by considering patients with breast cancers involving supraclavicular lymph nodes treated with adjuvant radiotherapy. In this case, Hepilor reduces both the frequency of incidence of dysphagia and the administration of steroidal anti-inflammatory drugs. In this study, it is demonstrated that Hepilor successfully heals injuries at the intestinal level in patients that chronically take low doses of acetylsalicylic acid. These patients were monitored by using the capsule system before the treatment and after 4 weeks. These endoscopic images representing the injuries caused by acetylsalicylic acid low doses therapy were evaluated in the present study. The graph highlights the injuries distribution between the patients included in the present study. The results after 4 weeks demonstrated the ability of Hepilor to strongly reduce intestinal injuries. In this study, the increase of healing incidence of Helicobacter pylori gastric infection by employing Hepilor treatment combined with eradication therapy has been demonstrated. The patient has been divided into two groups. In the first one, they followed the standard triple therapy with the clarithromycin, and in the second one, Hepilor was combined with the standard treatment. The results show a clearly increased proportion of eradicated patients in the second group of patients that was treated with eradication therapy combined with Hepilor. In this study, two different doses of Hepilor have been evaluated in combination with the triple therapy with clarithromycin, amoxicillin, and omeprazole. It is clear from the graph that the proportion of eradication in the groups A and B that were treated with Hepilor is higher with respect to the control group C that was treated with only the triple therapy. In this study, Hepilor has been employed to treat and prevent mucositis caused by radiation therapy in that patients affected by head and neck cancer. The results show that by preventively dosing Hepilor, it is possible to strongly reduce mucositis with respect to the control group. In this study, Hepilor was also used to prevent esophagitis caused by chemo and radiotherapy employed to treat lung tumors. The results confirm the effectiveness of Hepilor with this kind of patients. In fact, we can see that Hepilor reduces and delays the incidence of esophagitis. Now we're going to show you all the Hepilor formulations available on the market at this moment. We have three different types of formulations, and each one of them has a specific therapeutic purpose. The dental rinse contains other ingredients suitable to be used for oral cavity. The liquid one is used to treat esophageal injuries, and the capsules act at the gastric level and at the first section of the intestine. The dental rinse formulation is able to treat all the injuries and inflammation of the oral cavity mucosa, such as aphthic, stomatitis, mucositis, xerostomia, gingivitis, oral surgery, etc. Moreover, Hepilor is helpful after surgery in order to decrease healing time of oral mucosa and gums. It is important to notice that with this formulation, 3 rinses for at least 2 minutes are recommended without ingesting anything for at least 1 hour. The liquid formulation is capable of treating several injuries of the esophageal mucosa. In particular, it is used to treat all the reflux esophagitis since Hepilor does not alter the pH but directly act on the mucosa. Moreover, it is also used to treat mucositis caused by chemoradiotherapy as mentioned before. The recommended liquid formulation dosage is 2 doses given twice daily away from meals. In fact, we suggest to take it at 10 a.m. and 10 p.m. Since Hepilors act by direct contact with the mucosa, it is important to take it on an empty stomach without drink or eat anything for at least 1 hour. The capsule formulation is more effective at the gastric level and in the first section of the intestine with respect to the other 2 formulations. It is used as coadjuvant in the eradication of Helicobacter pylori and in the treatment of all the gastritis, as reported in the present slide.